Welcome back. This is Sleep Better TV. I'm Scott Drake, and we continue our discussion with Dr. Larry Pribyl with the Center for TMJ and Sleep Apnea in Independence, Missouri. In this segment, we'll be discussing sleep apnea and the health risks associated with it. Dr. Pribyl, what are some of the predictors of obstructive sleep apnea?
One of the main predictors of obstructive sleep apnea is snoring. About 60 to 70% of Americans snore. And of that group, a large percentage have apnea as well. So just because you snore doesn't mean it's innocuous and there's no issue. Neck size is also reflective of potential apnea. If you're a woman and your neck size is 16 inches or more, and if you're a man, 17 inches or more, that increases the likelihood that you would have apnea. And also, obesity is a huge issue in our country. BMI, body mass index, over 30, you have a high likelihood that you could be an apneic.
So many of us have heard that someone who is overweight might be more predispositioned to have sleep apnea. If someone loses weight, will that affect their apnea positively?
Yes, weight has a direct reflection on sleep apnea. So you increase your weight, you not only visualize it externally, but also inside. The added weight closes and compresses, makes your airway smaller. So weight loss can have a very positive effect on apnea. As a matter of fact, if you lose about 10% of your body weight, that contributes greatly to a reduction in your sleep apnea, and in some cases can even cut it in half.
What are some of the particular health risks associated with OSA?
A couple of the main health risks are cardiac dysfunction, heart attacks, strokes, diabetes. There's even relationships to colon cancer, erectile dysfunction. All these things put together can contribute more to, there are more issues with patients that have OSA. You're much more inclined to have these be part of your health issues. And if you manage your OSA, that can greatly reduce these other issues as well. So OSA is like the hub of a wheel, and these other health issues spur off of that.
So is sleep apnea something that you can cure? Is it something that will go away eventually?
OSA needs to be managed instead of cured, and so you go through, and if you have a CPAP machine that you wear nightly or an oral appliance you wear, you need to manage that by wearing those items every night.
All right, doctor, thank you.
Thank you.
My guest has been Dr. Larry Pribyl with the Center for TMJ and Sleep Apnea in Independence, Missouri. I'm Scott Drake. You're watching Sleep Better TV. I'm probably going to do the first 6 or 7, then I'll come back tomorrow and finish them.